What about too much exercise? How much rest do these patients need?
Well, that's an interesting question because in the previous video we talked about high intensity training and how the work to rest ratios are supposed to be with GLP-1 programs, but it's still kind of a crapshoot here because there's so little evidence and there's so little research and experience from people who actually work with folks who are taking these medications. But I would say that GLP-1 patients probably would need twice the rest of anyone who's not taking this type of medications. And why do I say that? Because if they have so little food in the system and so little calories to sort of help with their energy production, then they will probably be a little bit more fatigued after that second and third set. And even if it is a a moderate amount of weight. So I would say that if you're wanting to rest and you say, okay, well, we're going to go for maybe 2 minutes or so, I would do an exercise heart rate. I would ask them what their perceived exertion is after every set. How are you doing? How are you feeling? Can you do another set, et cetera, et cetera. And then I would also do things like measure blood pressure, because that's going to be a pretty good indicator of how well that they are doing, just in terms of if blood pressure is too low, they probably need to sit for more. Blood pressure is too high, that you may want to back off on the intensity. So it's it's something that is going to be trial and error for the industry over the next year in terms of how much rest people are going to need. But I would say, if you already work with seniors, people who have osteoporosis, other frail type conditions, dementia, etc., you would do the same type of conservative approach to their work to rest ratios.
And where can I learn more about exercise strategies and GLP-1?
You would log on to medhealthfit.com and click on the GLP-1 button.